there should be no shame. Should be no shame in those the the symptoms that you're feeling or the chaos that you feel inside. No shame to talk to a doctor about it and figure out what is going on and optimize your hormones. It's safe, absolutely 100% safe. So there should be no shame in doing it. All natural, right?
Mm-hmm.
So we don't live in a natural world, so should be no shame in that. And you should, if you have it available, take care take care of yourself. Use the options that are available, and don't be embarrassed about it.
Welcome back to the Delulu Magic Podcast. We are so excited to have Dr. Philip Gallegos with us today from Thrive Medicine Clinic. He specializes in regenerative and integrative medicine, so anything from peptides, hormone replacement therapy, GLP-1s, which is, of course, a big one. And what I really love about your practice is the fact that it's not just about a quick fix. Like, you're really about optimizing the body, but in a very intelligent and sustainable way. So welcome. Thank you so much for joining us.
Thank you. It's an honor to be here.
Yeah.
It's also interesting to hear my last name being pronounced so correctly.
So yeah.
Oh, it's a good one, right? It's always nice.
Anytime I try to pronounce it like that to the lay person, they're like, what? So it's just always modified to Guy Agos. Easy to say, Guy Agos.
Yes,
Oh,
I feel
okay.
the same. I
And
know.
I've been called everything. Galapagos,
been there.
Galagos.
You're like Dr. G's good.
And I know, yeah. So I just go by Dr. G. It's easy.
Oh, that's true. You do
Everybody can
that.
say that.
Yeah. I've heard you mention him like that too. Well, good
Yeah.
to know. Yeah. I'm very excited to be here as well. I'm Gabby. I'm a little bit of a dive into everything that is functional because I have autoimmune issues.
Okay.
So, and I've known about them for about close to 20 years. So
Mhm.
I've been all over the city.
You've been down the rabbit holes,
I
I'm sure.
have read so much and know so much about it, about the, you
Yeah.
know, basically anything functional, anything
Mhm.
anti-aging, longevity. I've got a little bit of background in my history is that like all, I'm Latina, both sides have the high blood pressure, both sides have the diabetes, both sides, all that stuff. So
Mhm.
that really kicked it in for me when the peptides started coming around, right? Which was a couple of years. So
Mhm.
I know that they've been around for performance and, medical use, but my big question is, what do you think caused it to go mainstream? Like, besides, I mean, I'm sure you've been
It's social media.
social
It's
media. Yeah.
What
It's
drives everything now.
yeah.
Yeah.
It's all the gym bros that are on there selling this stack or that stack. I think it's just the power of social media. It's there now, so everybody jumped on it, and it's a easy way for people to sell them on there. Not the best way to buy peptides,
Yes.
but it's an easy way to make money for people, and people want the quick fix, unfortunately, right?
Okay.
So they don't want to do the hard work. So
Yes.
I can just take this injection. It's going to make me be amazing, and I'm going to be able to levitate and see through walls, because that's essentially a lot of these peptides are promoted to do these crazy things, right? And people don't have realistic expectations. But yeah, I think it's just the power of social media
Power of
that
social-
that have pushed them into the forefront,
Yeah.
for good or bad.
Yeah.
Yeah.
So.
What did so you've been doing peptides for how long now? When did you start getting into the whole regenerative space, and why?
So we've been doing peptides as people know them, because there's other peptides that have been used for a long time, but the general peptides that people are talking about, GLP-1s, we probably 4 years since the beginning of the business.
Okay.
And then so we've learned the goods, the bads, the everything. We've had to go through all the different types of pharmacies and learning about research use, clinical use, actual pharmacy grade medical use peptides. So we've gone through it all because we're under more scrutiny as a medical clinic than somebody online. So we've had to learn a lot and really kind of just dive into it, because there's no medical training that you have in your training as a physician about peptides. So it's things you learn, but take along the way, and then you got to sift through all the nonsense as well, right? So
For women that are, for Gabby and I, we're past the age of 40, and that's really when we started noticing all these just issues of perimenopause, of being exhausted, of the cognitive, like the brain fog. What are some of the big things that is it mostly women coming in? Is it men? And what are their main complaints?
I think for us, we're about 50-50.
Okay.
But if you look at statistics, women by far spend more healthcare dollars on wellness than men. So I think it's like 80-20 or 70-30. It's
Wow.
something pretty stark, but so women will drive that. So more women will be interested in coming in. Now we have a lot of men, but that wasn't by design. We started doing a lot of men's health,
Mm-hmm.
and men are really focused on their penis and how it functions and erectile function and all that. And there's a T clinic on every corner, right? So
Yeah.
there's a lot more available for men really easily.
Mm-hmm.
So we have a lot of men, but women largely get ignored in medicine. Whether it's the way the studies are conducted, they very rarely include women. So all of these things, menopause, largely ignored with hormone replacement. And they had a faulty study out with the Women's Initiative, Health Initiative that was out, and they just recently came out and said all of that data was wrong. So all of these decades, women have been denied hormone replacement, have had this fear of hormone replacement. And then so you have this whole generation of women thinking, oh, no, that's going to cause me cancer. That's bad. And then so you have like the next generation down that's suffering. And now we're trying to educate, like, yes, you should be on hormone replacement. It is healthy. And then you get, some people are like, well, it's not natural. You just go into menopause. Well, nothing in this world right now that we live in is natural.
Yeah.
We live in a totally unnatural world. So we're not living like we did when we were quote unquote natural. So augmenting your hormonal status so that you don't suffer there's nothing wrong with that. There's no shame.
Absolutely. To suffer like needlessly. And I do feel like women suffer in silence versus right with men and them coming in for, sexual health because they're going to tell you. I think for women it becomes a little embarrassing. Maybe it's like on the third or fourth visit, or do you feel like does it take a lot more to pull it out of them for them to actually tell you, hey, this is how I'm feeling, or I'm having, certain issues compared to men that I feel like they come in and they're like, let me tell you, and I want you. What do you have for me?
Yeah, I'm gonna piss off the men, but men are babies. They come in here and they're so yes. Generally, women do suffer in silence, but they do when they come in, and we just start having a conversation because all of our visits start off with a conversation, and I'm just asking just general conversations about their life. What do you do? Are you a working mom, stay-at-home mom? Are you a career woman? Are you married? Are you what? Just asking questions, and that starts telling me about their lifestyle and like asking about their sleep and asking, and then they just start laying it on you like I have no drive, my libido is down, I'm not sleeping, I'm losing hair, I'm gaining weight, I'm doing 20 Pilates classes a day and only eating lettuce, and I'm still gaining weight. So it's like then all that information comes out, and then we start having the conversation of, hey, well, what do you think's driving this? Have you thought about your hormones? Have you ever had your hormones checked? Or they're like, yeah, I've been on birth control since I was like 13 because I had really bad periods and I was put on by my OB-GYN doc and never taken off. So there's so much things that women go through that don't realize, like, oh, I wasn't designed to be on birth control for my whole life. Like there's some side effects to that. Yeah. It's just, yeah. And just people, yeah, just people don't talk about those things. Like, it's just kind of widely assumed like this is, like I said, a lot of women, don't get, properly diagnosed, properly seen, properly treated. Like we were talking about earlier, somebody's husband said, just go out and walk a little bit more. You don't need to go on a medication. Well, it's not that simple sometimes. And men are largely, they don't even understand their own bodies. And they're going to try to tell a woman, just suck it up. You'll be okay. It's like, let a man have a baby or let a man have hot flashes and see if they're not in here. So, but for them, it's like, their erections go away and they're running to the doctor. It's immediate. It's
Absolutely.
yeah. But women have sexual dysfunction as well. Large amount of women, and they just don't talk about it because there's either shame or there's not enough education or just not understanding about their own body, or they just embarrassment.
Or they just think it's normal.
Yeah.
This is the way it is, just
You're
with
aging.
menopause. Like,
Exactly.
it's just
Yeah.
part of the process. And let me just suck it up and go cook or clean.
Oh my gosh, Paula. So I'm very curious because I've been very involved in this for a long time. But if somebody's new and comes to you, like let's say a woman, And Yadi, you have you introduce them to, you do the questions, you kind of like consult with them. How do you, if somebody who's never heard what the word peptide is besides GLP, because I know that there's different things that will also benefit us as women. Like
Yeah.
I'm very interested in that. Paula knows that because I know there's more, right? So how do you explain, go in, into detail for them?
Yeah, so we don't even mention the word peptide
Okay.
until we've had lots of visits and
Okay.
working through a lot of different things. So we really get to the root cause. You hear that a lot, but it really is. It's like, let's start with the basics first. And so if you're wanting to go directly to an injection or a peptide, but you're not changing anything else about your life, it's not going to work as well. So what we talk about first is, how's your sleep? How's your stress management? How's your activity, your exercise? How's your diet? How's your lifestyle? How's your relationship with your spouse, your kids, your community? We talk about the main pillars. And then from there, once we're starting to make some changes and there's some consistency, now let's pull this tool out of the toolbox, this peptide, to maybe help you with losing weight, putting on muscle, having improved cognitive function, improving libido. So there's kind of peptides for all different types of things. But the peptide conversation doesn't come till much later. It's not like you're walking in the door and we're talking about peptide, unless it's an experienced person that's already, as the quote unquote biohacker, already doing all these things, and they're interested in us clinically guiding a peptide regimen for them. Then we'll talk about peptides, but it's a conversation down the line.
So you're teaching them.
Absolutely.
You're guiding them the whole time. I mean, making
Yeah, it's
sure that
absolutely.
you know exactly what's going on, and not just doing the, here you go, here's a treatment, and go home and figure
Traditional healthcare, I think when
yes.
you go to a doctor's office, I have rarely had that. I don't know about you, unless it's an integrative or but that you're having that conversation of even, how's your relationship with your husband? How's your relationship with your kids? Are you in fight or flight, pretty much all day long?
How's your mindset too? Like we believe a lot of that, where are you feeling, like all that, are you just surviving, and not knowing what's really going on? Like, I think that spikes for both of us. It spiked a lot when we got to our 40s. I think mine, I knew that I had the autoimmune stuff, and then I see a doctor that she's integrative as well, but I remember they did some blood work, and I did all the things that you mentioned earlier. I was working out, eating. I mean, you would have thought I would have been picture perfect person, right? And they did this lab, and I came back, and she's like, "You're insulin resistant." And I didn't have a lot of weight, like a lot, but I had the visceral weight. Like, it didn't matter what I did.
Yeah.
And she started me on a GLP-1 at that time, and I didn't know what all the good was going to come from me. But I did go to where I lost too much. Like, I was like gaunt, because it was too much for me, and I lost muscle. Then it took me learning again how to eat correctly, working out correctly, learning to sleep, and bringing all those things. That was mostly on my own. I got off of it because I was like, I don't need to be on this forever. I'm good. But I have high blood pressure, and I realized when I was on the GLP at a low dose, my blood pressure was controlled. Do you know why that happens, or is it because just I don't have as much going on with my body? Or
it could be a number of things, but it is a lesser state of inflammation. So one of what they call a pleiotropic effect, which is a non-intended effect of the peptide or a drug, is that it has other effects, and so it is decreasing your inflammatory state. So they're now seeing people with Hashimoto's or other autoimmune diseases. It's decreasing their inflammatory load, and they're starting to get better. And so with hypertension, there's a lot of different causes for hypertension. But if it lowered your inflammatory state, you lowered your visceral fat, your blood pressure would lower some. But without knowing your full picture of what's going on. Definitely, we see that as well. But most of the time, so we're seeing a reduction in blood pressure because people are losing body mass. So they're losing the visceral fat mass, the subcutaneous fat mass, which decreases overall pressure, or their sleep apnea gets better because they're losing weight. People with sleep apnea will also get high blood pressure. So, or they're improving their sleep, which is going to lower your blood pressure. or if you get out of that fight or flight and you're reducing your stress, your blood pressure is going to normalize. So there's a lot of factors that go into that. But yeah, it's just definitely, there's a lot of unintended kind of favorable effects of GLPs, in particular, that we're just now starting to see that it's not just about losing weight. There's a lot of other positive effects that you get from them. People having babies now because they get to a healthy body weight, and then boom, they get their infertility goes away. So you can hear these so-called Ozempic babies is the term.
Ozempic babies.
Yeah, yeah, that's a thing on TikTok. Yeah, yeah, but but yeah. So there's both positive and negatives. Like you were not. It sounded like you didn't have the education of what all came with that GLP-1 and the things that you could have done to prevent those side effects. So, and that's what we do when we institute GLP-1 therapy with patients, is that you're going to get a lot of education, and we're going to be checking in a week, every 2 weeks, to make sure that you're on track and that you're doing the things that we're asking you to do. And so that will prevent a lot of the things that you experienced.
Yeah.
And I think for so many people that have done GLPs, obviously have probably yo-yo dieted in the past. I'm talking about
Almost everybody.
people. I'm other people. I'm other people.
Yeah.
I'm the people I'm talking about. And what I realized, right, when GLPs got, obviously they're really hot, but where you could, get them, and now you're doing them at the house. You're not really checking in. Maybe you're going like once a month. Was the fact that, yes, I lost the weight, but then, like you said earlier, like the habits weren't changed. And so you still stay in that same identity. So you lose the weight, but then you go back. And so it almost becomes like a yo-yo diet as well, which can be, I'm sure, very dangerous and detrimental to your body. So that's fantastic that you guys really make sure to understand that patient and walk them through everything. I think that's extremely beneficial.
Yeah, it even occurs in bariatric patients that go and seek surgery and have a gastric sleeve or a bypass. So they're doing a very invasive surgery to lose weight. And at the very beginning, they lose weight and their blood pressure normalizes, their diabetes goes away. All of these problems that they have, these chronic diseases, will reverse. But the key is they never addressed what their relationship to food was. And so then that rears its ugly head again, and they go back to the same habits. They don't change the way they're eating. They don't make sure that they're exercising. So at the end of the day, no matter how invasive of a surgery, an injection, a pill, or even doing it all naturally, you still need the lifestyle changes, and you need to address what your relationship with food is, so that you don't fall into that trap of, I eat out of stress, I eat out of comfort, I'm eating because I'm rewarding myself because I did a really good job at work or whatever. It's people have this relationship with food, whether they like it or not, and it can be very healthy or unhealthy. And that yo-yoing is pretty much every one of us. I don't think anybody can look at us and say, I have not yo-yo dieted. It's a rarity, right? That somebody, and so even what's, a lot of these, we get a lot of these influencers too, and that we're, working with them doing peptides, and even them, they look like, wow, you're either you're jacked or you're really fit. And you would think like, oh, they think, they have a perfect body, an ideal body, but their image of themselves or how they go about eating is they have some level of body dysmorphia, where their eating habits aren't that healthy. And then to your point, you said you were skinny and everything, and then they look under the hood and you take their labs and you start seeing, oh, they're insulin resistant, they have this, they have that, or they have a bunch of nutrient deficiencies because they're just living on chicken and broccly or rice, something like that. And they just, they just eat that same thing over and over and over.
Nutritionists gave that for years.
Yeah.
Oh my gosh, that was a window. We all went through that.
Yeah. So it's yo-yo dieting has just been a part of society because we've all had this kind of problem with weight gain, weight loss. And so you have to be mindful of that when you're putting people on this therapy, and especially asking those questions like, have you had an eating disorder in the past? Have you suffered with anorexia, bulimia? Because now we're dealing with a psychiatric issue that can rear its ugly head again, and those people can have problems.
Yeah.
So you have to screen for all of those things. It's not as simple as just fill out this questionnaire and we're going to mail you some GLP.
Yeah.
And I think that's the big problem right now.
Absolutely. Yeah. What would you say are some of the things that people need to really be wary about, especially when they're seeing, all these different advertisement, all these, trainers and everybody like, oh, here's my code, get the peptides. What are some of the risks in doing that?
So most of the peptides that those trainers or those influencers that you see online are getting research-based peptides. So there's a handful of companies that sell for research-only peptides, and so they're just reselling you those research-only use peptides. And a lot of those peptides are not third-party tested for purity, for contaminants, for potency, for proper dosing. So you're essentially a lab rat. You're getting something that you don't know what it is, where it came from, and where its origins are from, and if it's actually what it's saying it is, or and then a lot of them too are you're getting it and then you have to reconstitute it yourself, but you're not taught how to do that. And so if you've never reconstituted medication, you don't know how to convert the milligrams to units to mLs or how to properly dose it. You can have some mistakes. And even as somebody that you train here in the office to, okay, you need this many units is going to be your dosing, and you say 10 and then they drop to 100. Well, that's a big difference in dose, and they can have a really, really bad experience, especially with GLP-1s. You get somebody calling you, I'm dying. I think I got to go to the hospital. I'm just throwing up. It's like, okay, what dosing are you doing? So it's, if you don't have somebody guiding them, they can get in trouble.
Yeah,
And that's where you hear about this is where you hear about people getting pancreatitis, so inflammation of their pancreas, or their gut paralysis is because people are just, it's the Wild West out there. People are just dosing really high doses,
or stacking a ton of different ones, maybe when they don't know.
Yeah,
exactly
they have no clue.
if they're
And sometimes they're not even
they're
not even compatible in the same vial, and so they'll just mix them, and so they're just doing an experiment at their home and then just injecting those, and they have no clue because they're all at different pHs, and there's a lot that goes into it. So you can degrade one or change it into something else. So you got to be very careful in what you're injecting in your body.
Yeah.
So yeah, and I think it's just people are just flagrant with it.
For sure. And I also feel it's hard though. I think you hear of all these amazing, there's so many different peptides right now. And I know, Gabby, you've been researching, a ton.
Yes.
Are there any that you want to particularly go over or ask about?
Well, yeah, I mean, I think mostly my son's really big into it too as well, but obviously like the repair ones, the ones that when you have injuries, like if you're already a biohacker, let's call it, right? Because you're already looking at other things. Like I know the one glow, I've been interested in for like a year, but I do not want to go and buy it and just randomly. I'm glad she's here with you, because I know that also helps with collagen, all that stuff, Which one else did I ask you about? Cemerlin?
Yes.
Yep.
Yeah.
And then
Yes, and cognitive, yeah, that's a big one for me. That I mean, I've got like I feel like I don't know if we all have ADHD or it's just the world and perimenopause, because it feels like it just the whole thing happened, right? And
yeah, I think it's so to answer that question is we practice distraction. So I know your podcast is really focused on mindset.
Yes.
So what you practice is what you're going to become. And what do we do all day, every day? Distraction. Quick hit, dopamine. Let me doom scroll, or you're laying in bed bored. I can't sleep. I don't know why I can't sleep. Well, put the phone down. You're just your mind is still activated. So I think for that particular thing, I think we're practice distraction, and we teach our kids that same thing. So that's why we see a lot more ADD. It's just we all have attention deficit because we don't really just stay mindful and present in what we're doing. But some of the peptides, so there's different classifications of peptides. So there are those regenerative healing peptides. So BPC 157 is one that you hear all the time. Everybody's talking about. You think it's going to grow you a new limb or something with the promises they make. So you hear that you hear Glow, Wolverine, all these different stacks. But so you have growth hormone secretagogues. So these are peptides that stimulate your own body to make growth hormone, which is a repair and healing and longevity and the what they call the fountain of youth, not necessarily, but it's something that you have a lot more when you're young, hence why you can recover and heal quicker, and that declines over time. So what you're doing is giving somebody the peptide to stimulate growth hormone so that you can get your levels up and perform and heal quicker. You have other peptides that are like anti-inflammatory or healing peptides, like BPC 157. You have other peptides that are cognitive peptides or nootropics that help you lower anxiety, focus, and those are things like CMAX, C-Lank, cerebrolysin, things of that sort. And then you have immune peptides like thymosin alpha-1, thymosin beta, or TB500. So all these ones are pretty common peptides. And then you have peptides like GHK copper, and that's like in the GLOW stack. And so what you're trying to do is stimulate collagen production, improve skin elasticity with those. So you can combine certain peptides to try to heal or to induce a more kind of clarity of mind. Again, if you're going to rely on the peptide, though, to provide clarity of mind, but you're not changing how you live your life, it's not going to help. So you can use it as an adjuvant to be able to perform. So all of these are performing enhancing products or drugs, right?
Yeah.
So you want to use them in a way that they augment what you're already doing. So just because so if I take steroids and I go and try to hit a home run, the steroid itself is not going to make me automatically start hitting home runs. It's you have to be trained in whatever you're doing, and then those athletes use the steroid to make themselves better. So that's a good kind of analogy of what you're trying to do here. You got to change what you're doing, and then you're adding this in to kind of give you that little kickstarter, that improvement. So, but people expect like, oh, I take this peptide and I'm going to be this amazing athlete and I'm going to be jacked and ripped without ever lifting.
When all day you're like on the couch eating chips.
Exactly.
Like, but I'm about to go.
Yeah,
I'm
it's
about to do
exactly.
this.
So, the peptide's not going to induce you to get up and go have motivation, right? But yeah, so the Wolverine stack that you hear about, that's typically it's a combination of some growth hormone secreted like semerelin, testosterone, CJC 1295, any of those that class of peptides combined with like a thymosin alpha, and then the BPC 157. That combination helps you heal, and it will improve how quickly you can heal. Now, is it gonna, if you have a torn ligament or tendon, is it gonna help it regrow? Probably not. But people think that's what they sell online.
Yeah.
So it's got to be reasonable. Like, is it a good thing to have like after surgery? Yes, it helps you heal from surgery quicker, or you're having a regenerative procedure like a PRP injection into your knee or your shoulder. You add the peptide. Yes, it'll help you speed up healing. Now, the GLOW peptide, that's the GHK copper along with the BPC 157 and then different combinations. And that one is to improve skin elasticity, collagen production, skin appearance. And again, yes, it can do that. But if you don't change your diet and you're eating like crap and you have acne, it's not going to cure your acne, or your hormones are all messed up and you have acne. So it just depends like what you're doing. If you're smoking, it's not going to automatically improve your skin tone if you don't quit smoking. So you got to keep it in context. Like, yes, it'll help you, but are you already doing skincare? Are you also not spending all day in the sun and getting, your
Damage.
sunburn?
Having a good foundation.
Exactly.
So it's almost like having that soil, right? And if you've got bad soil, no matter what, nothing's going to grow, or what is going to grow, right? A bunch of weeds. So having the right fertilizer. And that's why it's so important to consult with a doctor. Everything you're saying sounds very specific. Like, that would be crazy for people just like, you're just taking a bunch of ones that you don't even know what they do, where they're coming from.
And different combinations, or this influencer told them to do this. That you hear a lot of like blanket statements, like everybody should be doing sauna, everybody should be doing cold plunges, everybody should be doing cryo, everybody should be, and that's not necessarily true. So everybody's very individual in what's going on in their life, and there's sometimes, yes, it's appropriate to do this intervention. Sometimes it's appropriate to do that intervention. But with peptides too, yes, they're relatively safe if they're sourced from a right place, if they're dosed appropriately, but they can have complications. You can have serious complications with them that people don't talk about, right? Because people don't want to talk about the negative things online. They just want to talk about all the great things. But yeah, you can misuse them easily and suffer organ damage or suffer some problem, that unintended consequence that you weren't even aware of. And then where is that influencer there to help you? They're not there. So if you're working with a reputable physician that uses these on a regular basis and has a medical license and their reputation on the line, yes, they're going to guide you, work with you, talk to you about the negatives, the positives, and then get you to alternate the peptides when appropriate so that you get the result that you're trying to get.
Yeah.
So yeah, and you get every now and then the biohackers that are like, oh, I just want to do this because they're always doing something, right? And people seem to be more and more educated these days, but there is a lot of misinformation out there. So people come in and they're misinformed and they just want to try something because they heard somebody online that was famous tell them to use it.
Yeah. With so many different peptides out there, which ones are the ones that you're most excited about or that you've seen the best results with for your particular patients?
Yeah. So unfortunately, last year, or the last year or the year before, they passed, the FDA put a list out, right, and took a lot of the good peptides off the market, BPC 157 being very safe peptide. That came off. A lot of the growth hormone secretagogues came off. So we've had to work around those types of peptides and get different types of biomodulators that are similar in action to do that. But some of the ones that we still use in clinical practice that we'll have is PT141 that one is FDA approved, and that one is for libido, sexual desire, orgasmic function. So that one is FDA approved for women with low desire, low arousability. So we use that quite a bit because we have both men and women's sexual health here. So that one's used quite a bit, very, very safe. Again, you have to understand how to dose it because can be side effects or problems, and it's not going to fix, everything. So people want like, oh, I'm going to be this performer in the bedroom after taking this PT 141. There's a lot of things you got to address, right? So, but it definitely helps. It definitely helps.
Desire, right?
Yeah.
Which is very interesting
Yeah.
compared to like, I guess some of the things that are for men out there.
Yeah, so it definitely improves desire and improves orgasmic function for a lot of women. So again, like you're saying, that's largely not addressed in women. So it gives them an option for them to have something in their toolbox. So on the sexual side, I think PT141 oxytocin is another one that we use, and that's your love hormone, right? So when you give birth and you first see your baby, you release tons of oxytocin. When you're hug a loved one, or you hear your child's voice, that you're releasing oxytocin, or after you've had intimacy with your partner, that feeling of relaxation and connectivity, that's oxytocin. So that's another one that you can use when there's kind of again, for arousability and this disconnect. You can combine it with a PT141. So that's one that we use a lot, that combination. Again, because we do a lot of sexual wellness here. We do different stacks here depending on like body composition. We'll use a lot of Samoralin. That helps a lot. So that's also a good one to pair with a GLP-1 because what you're trying to avoid is that muscle mass loss. So we use it as a kind of counterbalance along with protein intake and resistance training. But yeah, so that one we use quite a bit. So we use a lot of the growth hormone secretagogues. We use a alternative to the BPC 157 that is a bioregulator. So we have a couple different ones that we kind of use on a consistent basis. And ones that I've loved that are not currently on the market, but hopefully come back are like Mod SC, SS31, Epitalin. So all of these mitochondrial regulators that improve mitochondrial function. Having tried those and used those in the past, absolute game changer in how you feel. Again, you got to make the changes, but it definitely will improve your energy production, how quickly you can bounce back from your exercising or a lot of stress or travel.
Let's talk a little bit about the mitochondria because like we hear about it, but what
Is the mitochondria?
what is the
You don't know?
mitochondria?
You
No,
don't know?
but and exactly how does it work with the mitochondria for some of the ones that you just mentioned, right? You need
Yeah.
that like
Those-
cellular turnover.
Mm-hmm.
Yeah. So mitochondria are in every cell of your body. So they're people don't realize like within each cell there are tiny little things called organelles. So these other tiny little things stuffed into the cell that are doing different functions, either repairing the cell, writing DNA, making energy. There's all kinds of stuff that are going in the cell, but it's so tightly packed, and there's so many of these little mitochondria. And what most people hear, people will describe it as like the battery of the cell, the powerhouse of the cell. So you have this cycle that occurs in the cell that makes energy, and so within that energy cycle, you have this compound called ATP that's made, and so ATP is the cellular energy currency, and you also make NAD, and so people are familiar or have heard NAD or use NAD as a therapy. But so you're making these compounds, and so the cells or the organs in your body that are doing a lot more work have more mitochondria. So your brain, your heart, your ovaries, because you're producing life. So you're producing your eggs, and all of these have more mitochondria. So the mitochondria are constantly making energy, and so that pathway of making energy can get damaged or poisoned with how we're living, what we're eating, what we're drinking, what we're consuming, lack of sleep, lack of sunlight. All these different things can affect how those mitochondria work and make them inefficient. And when you have mitochondrial dysfunction, so the mitochondria aren't working like they should be, that's kind of the genesis or the start of disease. And so what you're trying to do is improve mitochondrial function by mostly by changing somebody's lifestyle and what they're doing. But then you can add in these regulators such as SS31 or MITC to improve the function of the mitochondria and have it work more efficiently, kick out more ATP, and then turn on other enzymatic or hormonal cycles to improve how you feel and how everything's function. So all of that works really well when you're young, and as you age, you're just taking damage, and then it starts not working as well, and then your ability to compensate goes down. So what you're doing is trying to add those regulators, those biomodulators in to help improve that cycle within the mitochondria.
Sounds
Perfect explanation for our audience. So
Again, I was trying to explain it by not using
like
big
me.
words and trying to, because
It was
when
perfect.
people just throw out a lot of big medical verbiage or scientific verbiage, you just get lost in it. So it's just like, if you're not versed in economics or in finance and somebody's throwing out these acronyms or big terms, you're like, deer in
you just
headlights,
glaze,
right?
yeah, glaze.
So I have what you're talking about. So yeah, so you can just think of it as it's kind of like a battery, a rechargeable battery. And then if that battery starts slowing down, you're not going to have energy from it. So obviously much more complex than that, but just that's a good kind of simplistic way of thinking about it.
And I feel like people always hear about NAD as the very first thing when they talk,
Yeah.
when the offices will have for the mitochondria. But I love some of the other ones that you're talking about as well. It's sad that they've been, not as or that the FDA, pulled them or.
Yeah, and the key thing to know about is they just released another letter that they're really going to crack down this year in 2026 on these pharmacies making for research use.
Yeah.
So a lot of those things that you're getting online, you're going to be not seeing as much, or you're not going to be able to see physicians that can carry a lot of peptides, because people will ask us, hey, do you have such and such peptide? Well, we don't have that. Well, why not? I can go get it online. Well, you're going to risk getting it online, but we cannot get
really
it
know what you're getting.
Yeah, but we cannot legally source it right now, so we are not going to play in that or give you recommendations or give you advice on your peptide that you bought off of whatever site.
Yeah. And also none of this is medical advice. So
Yeah, no, it's not.
we're just all chatting.
Yeah.
Let's talk a little bit about, you mentioned microdosing a little bit earlier.
Oh.
Right. And now that's gotten so popular, right?
Yeah.
Microdosing for inflammation. Is that something that you're seeing a lot of patients that started on GLPs and then going to that?
Yes, and I think we started microdosing a long time ago because we noticed when you gave a standard dose, people didn't have a good response. People felt all of the side effects, the nausea, the tiredness, the depression, the constipation, the reflux. So we started dialing back the doses. We're like, well, can we just dial back the dose and still get a response? And so with um, anything in medicine, we learn it's like the minimal effective dose, but it wasn't applied to these GLP-1s. They just had a standard dosing. And if you had an auto injector, there was no way of really changing that dose. So once we had like the ability to access compounded ones, and we can control the dose, we started going to lower and lower dosing to see what was the minimally effective dose that we could still get a response from and lessen the side effects from, and still try to get a target weight loss of 1 to 2 pounds a week. So we kind of naturally gravitated to that, and both Dr. Langley and I are board certified anesthesiologists. So I think we kind of think in those terms of minimally effective dosing. So when you're in the operating room, you're adjusting dosing, and so we're used to adjusting it up or down depending on the patient in front of us. So depending on the client that we had with weight loss, we started playing around with dosings, and because we to be frank, we made the same mistakes when these drugs came out on the market, dosing like we were told to dose. And then we're like, well, this doesn't seem to be working.
You throwing up all day doesn't
Yeah,
seem to be good.
Yeah, this is not good. So we adjusted them. But yeah, microdosing as a strategy is great for many reasons. So somebody that's coming off of GLP-1s and have lost massive amounts of weight, like 100 pounds, 150 pounds, you can keep them on a microdose for a while. Because what happens when you take somebody off of a GLP-1 cold turkey and you don't have a strategy behind it, what happens is you induce some other hormones, one being ghrelin. So you have this ghrelin storm, and ghrelin is your hunger hormone. So it kicks in and it rages, and now you can't stop eating. You gotta,
Oh, wow.
yeah. And especially if you haven't been eating anything, now you're just eating, and so compulsively. So you have to do it gradually so you don't have those types of kind of rebounds.
Yeah.
So we use it as we wean somebody off. We use it in people with autoimmune like yourself to help with keeping that inflammation down as a strategy. Or somebody trying to gradually lose weight, we'll just implement that so that they don't have the side effects that you normally would with standard dosing. So I think as a whole, microdosing just makes more sense. And then now that term is just caught on. So now it's just like a buzzword. Well, I microdose this, I microdose that. But sometimes, medications aren't effective at a microdose. You have to be at a certain dosing for you to get the effect. So it's compound specific. So
It's an art. That's why you're the doctor.
yeah, so
Yeah,
it is.
an art.
So people don't realize that. So there's certain things that, you can microdose. Some things you can't microdose. So microdosing your blood pressure medication is going to help you.
Yes.
All right. So you got to take the dose that was prescribed for you, not just chop up the pill into little pieces and you take, I think I'm going to take this because over time it's going to work. No, it's not. So
Yes.
so you got to understand what you're working with.
As we wrap up, I wanted to, you see so many patients, you've been here for a while. Tell me a little bit about a patient success story, somebody that's really transformed, that you've just seen a huge impact and a life-changing.
Yeah, you asked me this question to prepare for it. It was like, what type of patient do I talk about? But I'll tell you one that's just was a fun story, because we have a patient that is a very successful businessman, but on the side, he's a drummer for a band. And the band travels all over the world. They go to Ireland, they go, so it's an Irish kind of punk rock band. And they're very well known. And so what he wanted, he had kind of same thing. He's like in middle age, his 40s, just kind of started having weight gain and everything, and put on weight. He's like, all I want to do is be able to get on stage and drum with my shirt off, like I used to back in the day. I'm like, okay, well, great. Like that's a very specific thing, right? So we instituted some GLPs, we instituted some sermorelin, some other peptides, and worked with him, and we also did some body sculpting with the BTL devices that we talked about. So did some M sculpt and worked on his love handles. He wasn't like grossly overweight or anything like that. He wasn't where he wanted to be, right? And so over time we've got him, now he's drumming without his shirt off, looks great, very, very happy. His wife, likes what she
happy.
sees.
She's
Yeah, she's happy.
Take the shirt off.
So that's just a kind of a fun story. But that was
Yes.
somebody that wouldn't have qualified for GLPs because he wasn't obese.
Mhm.
Metabolically, he was borderline insulin resistant and pre-diabetic, so we just kind of fixed that.
Mhm.
And then, but this guy was all in, like everything that we've done and told him to do, on it. And despite being traveling around a rock band, he's not drinking alcohol or engaging in any untoward behaviors.
Mhm.
In it. They just play, but it was just like eating poorly on the road, not
Yeah.
sleeping, all that stuff. So he's just kind of regimented now. He's got his little supplement stack that he takes with him, carries around with him, and does everything. And so,
And imagine how much better he feels. It's not just looking
yeah.
better, right? Like you can be on
And-
stage,
Yeah.
but having that energy.
And mentally,
yeah.
too,
Yeah.
right? Like you feel you have your confidence.
and he said it made him a
Confidence.
better boss too in his business that he has
Mhm.
as well. So like just the focus, the energy, the
Yeah.
ability to
Yes.
have the reserve to get through.
Yes.
Yeah.
You're a
So,
nicer
but that was a use of peptides in a way that just was for performance optimization. But again, he bought in and did all the work behind the scenes, changing his diet, changing his sleep, all these different things. It wasn't just him taking the peptides and voila, he had this transformation. So you have to do both.
Mhm.
You can't just do the peptide and expect it to, again,
Be a miracle.
Yeah, exactly.
hand in hand.
So that was, I don't know, that was just a fun story that came to mind because he had recently been in and like, wow, you look like a totally different person. And he recently went to a wedding where his brother was there, and his brother was like, oh, always looking good. He said, and he just went there and he was happy that he looked better than his brother. So
It's the little things in life.
That's
you know,
good.
like-
yeah, it's
Could be
just,
nice,
I don't
but
have
yeah.
any siblings, but yeah, it's that sibling rivalry. Right?
Yeah.
Show
Oh,
up to the
that's
wedding,
so
you're like, yeah,
funny.
I'm more jacked than my brother.
Yeah, I think everybody just wants to look at a
Yeah.
little bit better, just like the little improvements, right? It is about optimization, not totally changing how you look or who you are, but really optimizing.
Yeah, and
your
those
body and
those
leveling up.
tools are available, and so why not use those tools?
Yes.
In a safe way,
Yeah, absolutely, and do it under the guidance of a reputable clinic. And there's plenty of them out there that are going to walk and guide you and direct you through all of this
Mhm.
and kind of educate you on what you're doing, so that you understand the risks of potentially doing these or not, or where they're sourcing them, and or how you're using them. Are you using them inappropriately? Are you using them the right way to get the right kind of optimal result that you're looking for?
Yes.
Absolutely.
Well, we're in our 40s and we're ready to level up. So, yes.
That's what we're doing here. We're doing it all.
I'm going to be looking
It's
like
the
I'm going to be
motto.
30, feeling like I'm 20. It's going to be.
Yeah.
Yeah, no, it's just you can use these as, again, work on the basics. So it is like your whole podcast mindset is everything. So like we tell people, we can give you like the perfect protocol, or what we believe to be the perfect protocol, but if you don't have the mindset or the ability to engage in what we're putting in front of you, it's not going to be successful. Because if you just kind of sit there and want to be spoon fed, or you don't want to be an active participant. So like right above you are, that's our motto there, empowering your health in those books. And that's what we're trying to do. We're trying to educate the client so that they become the CEO of their own health,
I love
so that they become more knowledgeable. And if they're going to, even just if they're going to an outside of a regenerative or an integrative practice into just a standard practice, they learn to ask more questions. They're more informed. Like, hold the doctors accountable. Have them answer questions. They shouldn't be offended by you asking questions. They should be happy that you're wanting to get more educated about your own health and your own body and what you're going to be taking to get healthy, whether if it's a standard medication or a supplement or whatever it is, a peptide. You should ask questions about it, and they should spend time with you to go over that, or have educational paperwork or digital format or somewhere that you can go to learn. And that should be the thing, is you should be learning, just like you did about your autoimmunity. The more you learn about whatever condition that you have, the more empowered you're going to be able to manage that, and the more invested you're going to be in to either reversing it or managing it as best you can, so that you don't have flare-ups or anything like that.
Yeah, taking ownership, and how beautiful that we actually have these options now. 20 years ago when our, well, I don't
Yeah.
know how long ago my mom went through menopause, probably 30 years ago,
Yeah.
but they didn't have these options or any of these, solutions. So it's fantastic. I feel blessed to be,
Yes.
in this era where we have choices. And as women, we can actually say, hey, we're dealing with this. And that doctors like you will actually listen and see us, what we're going through, because it is, it's hard sometimes.
Yeah, and it's like I said, you're largely ignored, um, unfortunately, and that's just the way of the society. But there, you do have valid things that start changing in your 40s,
Yeah.
especially more rapidly now in the unnatural kind of environment that we live in, and all of these unnatural kind of pressures that are put on you as a woman to look perfect, especially with the advent of all these filters and everything on social media. So it's like, oh, every picture has to look perfect. You
Yes.
can't be in some, what you perceive as a bad angle, or you're required to be a super mom, a super wife, at the PTA, running a podcast like you guys are doing, having a side hustle, doing this. It's you're required to do so many things that are just not realistic, and eventually you're going to crash and burn. And if your hormones aren't optimized, if your thyroid's not optimized, if you have some insulin resistance, your body's just going to be a wreck, and you're not going to be able to think clearly. You're not going to be in the mood when your spouse is there after you get home. It affects every aspect of your life. You're going to be short with your kids. So when you can start optimizing all these aspects of your health, you're going to be a better version of you, to be a better mom, to be a better spouse, to be a better businesswoman, to be a better whatever it is that you do. So you're going to, or a caregiver, a lot of us now, have parents that they're aging. And so now you're in that phase where you're going to have to take care of your parents or help them. So that's another stressor that you see a lot in the age where women are going through perimenopause or menopause, is that they have aging parents. Now they're taking care of kids, spouse, and parents,
And themselves last.
and everything. Yeah,
And
that's the
themselves
thing.
at the
And
very,
you
very
forget
end.
about
Yeah.
yourself. And then, you come and you're a wreck. You just feel like you're not even the same person. Or spouses will be like, I don't even know this woman anymore. And it's just, you start changing all those things and addressing them. All of a sudden they blossom and become the old version of themselves, this beautiful version of themselves that are like, oh, well, and you'll hear a lot of husbands like, oh, I got my wife back now. So you hear a lot of transformation, and that's what's pretty cool about that. Like sitting on this side and actually talking with patients is just seeing not just you're affecting the person that's in front of you, but affecting the mom, the kid, the husband. You're affecting having a familial change, which is great. And hopefully those positive habits that the woman is engaging in transfers to the husband and to the kids. And now you've made a really big change in that family.
Yeah. That chain reaction.
Yeah. And so
I love it.
I think that is what it's all about.
And out there, that is, and you couldn't have said it any better. And I feel like that's the biggest transformation story, for you to be able to go back to yourself and like feel like the person that
Like
you are,
yourself.
instead of this cranky, person that you don't even recognize anymore. So
Yeah. There should be no shame. Should be no shame in those the symptoms that you're feeling, or the chaos that you feel inside. No shame to talk to a doctor about it and figure out what is going on, and optimize your hormones. It's safe, absolutely 100% safe. So there should be no shame in doing it. All natural, right? So we don't live in a natural world, so there should be no shame in that. And you should, if you have it available, take care of yourself. Use the options that are available, and don't be embarrassed about it. If you're suffering with it, so is 10 people around you that aren't talking about it.
absolutely.
And it's just with guys too. Guys aren't going to talk about their erectile dysfunction or this or that. So, but everybody around them's having the same problem. They're just not talking about it. So if people would just be more open and not be ashamed of, natural biologic processes that happen, or illness, you create more awareness. And I'm hoping that for women, and specifically, that there's more awareness that there's things out there that you can have treatments so that you don't have to suffer. So, and that's the thing is, educating them, and then getting them over those biases, and then letting them know what's available too.
And then I think that letting them know it's worth the investment. As a woman, I think because we're so used to putting ourselves last, you'll be like, oh, my kids need this, my husband needs this, yes, let's buy this. But as a woman, it is definitely worth coming in, getting checked out, and worth investing in yourself just because it impacts everybody. Tell us, how can they find you on, any of the socials or your office?
Yeah, so I'm not too active on social media myself. So, but the clinic is Thrive Medicine Clinic. That's a handle for their on Instagram and on Facebook. We're located here in the Heights in Houston, 802 West 18th Street. So you can come see the clinic. It's a I'm hoping that you guys will do some Be
Yes.
Real and show some of the clinic. It is an experience. We created it to be an experience, to be completely different than anything that you've experienced. So really kind of melding design, like exquisite luxury design, with understanding of biophilia, which is bringing the outside and the natural in, since we live in such
Which
an
you've done
unnatural
so
world.
well.
So, but yeah, come check us out at the clinic. You can see us on socials. We are getting more involved, and I am opening up and doing more stuff. Dr. Langley does probably a lot more of the socials than I do.
Well, you're busy
but-
treating patients, so I
Yes.
can't blame you.
And
Okay.
teachers.
No, but it's definitely a
Yes.
thing now in modern times, like for physicians to be more involved in social media. So it's like you have to get out of the old way of thinking. But so I'm starting to do that more. But yeah,
And you have such great information. I think it's
Yes.
it's so beneficial. Thank you so much for being on here with us.
well, it was an honor. I appreciate
Thank
it.
you very
Yes,
much.
yes.
Yeah, thanks.
Don't forget to share this with anybody that's on their health journey. And stay Delulu.
And make it happen.
Bye.